Yeah, now the live streaming is ready.
So now we can start. I think it is ready now. There's some error.
Yeah.
We will start now.
Yeah.
Okay. So welcome to all. My hearty welcome to all the participants for this webinar. I invite Mr. Radhakrishnan to give a welcome address to our guest.
Yeah. Good evening, one and all. Today, we are a new subject, a new topic, which is very interesting and which will be very useful for each and every one of us, because we are all eagerly waiting for school reopening. And we are confused what to be done when we reopen the schools, what precautions we have to take. So we have got a wonderful guest speaker for today, Mr. Udayakumar Kumaran. He is the Deputy General Manager, School Operations, heading Health and Safety and Child Protection at Edunation Services Private Limited, Bangalore. I have very close contact with Udayakumar for last many years. And I know him personally and professionally, and I know he is one of the best person available in the country to speak on this topic based on his experience and expertise. As per my knowledge, he might have been addressed or taken these kind of sessions for more than 500 in number, might have been addressed thousands of teachers and thousands of students. In this field, he is an asset to the country. And we are very glad that such an expert is coming over here and speaking on our platform. And those who listen to him, for them it will be very useful to plan how the school should reopen, what are the protocols you have to create, and how you have to plan and execute for safe schooling when the school reopens. I'm not extending my talk. I heartily welcome Mr. Uday. Along with that, I welcome all the directors of CEIR and also all the participants. Once again, I welcome Uday, our keynote speaker for today. Uday, it is over to you.
Thank you, sir. I think it's a very heavy introduction for me to digest.
No, you deserve it.
You deserve it. You deserve it.
You deserve it.
It's so nice of you and like the team of CEIR to introduce me.
Yeah.
Grand.
I think it is our 30th session, right?
Yeah.
29th.
29th session. Yeah.
Shall I share my screen, sir?
Yeah, please, sir, please.
Good evening, everyone. Let me just try to share my screen first. So is this visible?
Yes, sir.
Visible.
Yeah.
Your audio, sir, if you don't mind, can you be a bit louder?
Can you hear now?
Yeah. Now it's
better.
Okay. I'll use the earphone
please.
mic close to my.
Yeah.
So, good evening, everybody.
Good evening.
Quite not very interesting topic, maybe you find, but a very alertful situation, which when we have to consider for the school reopening phase, what all we have to do, what all the precautions and necessary measures that we have to adopt. That would be the key discussion point of today's session. I know everybody in this forum will be definitely having one question in common: when the school will be reopening in a normal manner. It was when the lockdown relaxation happened in India, and it was 4.0 guideline, unlock guideline, which is considered students of 9 to 12 can be permitted to school for a doubt clearing or academic support, along with 50% of staff also allowed during that unlock 4 guideline. but it was the same time, like it was announced to be like happening from the September 21st of 2020, but it was the same time where the highest peak of COVID cases in India has occurred. And in that guideline, it was also clearly said, like, the student can be visiting the school based on the consent from the parents. But at that particular situation, most of the parents was never willing to send their student to the school. And after that, unlock 5.0 guideline, which has come, where the central government has clear given instruction to the state government and the union territory to take a call based on the situation analysis of the local scenarios and the other aspects of spread in the locality. So there were a lot of news, updates which was coming, like it will be opening in the mid of October, then end of October, then post Diwali. At that current phase where it is, where we are standing is like the latest, as per the latest update, till November 30th, school will not be reopening. We don't know what is going to be happening in the future, but we will wait for what the state government takes a decision upon. But nevertheless, what we can do is like we can prepare our school to welcome the people, like including the students and the staff members, and various protocols can be developed and arrived upon to ensure that we are welcoming everybody into a safe place as like their home or trustable environment is. Coming to the fact sheet of COVID-19, most of you already know every details of it. Like I don't need to explain much of these aspects. Like caused by a virus, which is like emerged new in last year, and it was called as coronavirus. And this is mainly spread from people to people through respiratory droplets. And the symptoms of this can be ranging from mild to severe illness, even to fatality in a highest case. Incubation of this virus is 2 to 14 days in human being. The symptoms: fever, cough, shortness of breath, and fatigue. Other than that, we also have less common symptoms like loss of taste or smell, then aches in bodies and pain, sore throat, diarrhea, conjunctivitis, headache, a rash in the body, or discoloration of fingers or toes. Another big issue is like most of the people who are becoming a COVID-19 carrier are asymptomatic, and this also and most of the people also have a mild illness in them, which makes it difficult to identify the carriers of the diseases. And in some people, especially like aged, vulnerable people who are above 60, and somebody who are suffering from critical illness, even the case can be severe and fatal at times. Now coming to the key challenges, what it has posed is like it's a new virus, new disease, and we didn't have vaccines or medicine around this. It has come only in last year, November, December, which has started emerging in China. The biggest drawback of this is like a lot of asymptomatic carriers around. We don't know who is having the symptoms, who is actually the carrier of who are the carriers of the diseases around us. So this becomes a difficult challenges that we face across nowadays. And we also have a lot of lack of scientific information and data on the disease and the virus, especially on how the growth, the lifespan of the virus in certain surfaces or in the environment, and how long it survived. This data is still not yet clear. Like there are information being popped up saying, like recently there was a case reported saying there are this virus can even survive up to 28 days on glass surfaces and plastic. But still, these are not data that are authenticated by WHO or CDC. These are all news which is based on scientific experiments where the scientists around the world are being carrying out. Also about the spread, people. It was clear from WHO that the spread will only happen through the droplet from people to people who are in a close distance. But there are some studies even said like, it can even spread in a, it can be even like an airborne disease in a setup where ventilation or indoor atmosphere is. So this is again not validated by WHO. These are all news which is coming up. So we have a lot of gaps in accurate data and information in front of us. The biggest drawback I can say is like a lot of misinformation, confusions, and due to a lot of inaccurate and false evidences which is being circulated around social media during these lockdown phases, which parallelly have created a lot of fear amongst the people, and and a lot of social stigma started emerging. People started discriminating each others, and like especially somebody who recovered also, like they started facing this social stigma and discrimination. So this is something which has become a biggest challenging situations. And another important challenging area is like rise in the mental health issues. It has been mentioned like there was a huge increase in number of mental health issues like stress and heightened anxieties, depression, and other mental health related illness that are reported across the globe, which also creates a huge challenge amongst the humans. However, we have some reliefs or some positive factors in this situation. Is like there are some control measures that can be established. Seeing that is a droplet infection, there are control measures that can be incorporated that like include physical or social distancing, then hand hygiene measures, uh, uh, usage of PPEs, mask, and avoiding the contact with the surface or following a contact disinfection protocols frequently. We also some big relief is also is like we have trustable resources in front of us. Like we can always refer and validate whenever we get some information over social media or net. We always can refer to World Health Organization's Central Disease Center or Ministry of Health and Family Welfare websites to validate and authenticate the data which you receive. It is a curable disease and it's not a life-threatening. That's the biggest advantage. And we also have a higher recovery cases which is currently happening in India now. If you see like last 2 months, like last 1.5 months, if you see like the trend is slowly declining and we have got 85% more recovery. And as per yesterday's update, we have only like 5.87 lakhs of active cases amongst the total of 81 lakhs cases which are reported. So it's not life-threatening unless you have a serious illness or ailment among with you, or you are an aged community who are getting contracted with this disease. Also, very interesting factor is like amongst the students, as per WHO report, the illness is ranging in a mild variant without causing any much issues amongst the young generation. And overall globe, if you consider, it is only 8.7% of children who are affected with this illness. So that's a big positive factors for us, like considering we have a schools of even a higher secondary considering student age range as 18. Somebody's line is unmuted. Can you please mute that? Yeah. Now coming to what the key factors that the school administration team or the school operators should be thinking to consider when we are planning to reopen their school. So I'll be discussing these all points in detail one by one. Like I'll just first is to have a response team and proper response plans on various emergencies. We should incorporate training, awareness, and communication programs. We should have strict physical distancing and social staggering plans in the school. We should have a proper visitor and material movement control mechanism within the school. Radhakrishna sir, somebody is...
Hello, please mute your audios. Participants, please mute your audios. It is creating disturbance in between. Please. All the delegates are requested to mute your audio. Thank you. Yes, you can.
Thank you, sir. Thank you, sir. Hand hygiene is an important aspect which we need to look into. Usage of mask, personal protective equipments, then cleaning and disinfection and sanitization programs that we need to ensure while the school is operational. Incident management. Incident management. Occurrence of, if in case of an occurrence of cases, how we are managing space and contact. So this I'm going to discuss in detail in the coming slides. So these are the key things that each school need to focus while they are planning to welcome or plan to reopen the school in a phase-wise manner. The first thing is like having a response team and response plan. We should ensure that our school has got an active ERT team, that is an emergency response team, who are well dedicated, active, and it can be having multiple peoples, which should be a mix from all the department. It can be headed by the principal or the head of the institution. It can have administrators in that. It can have administrators in that. It can have infirmary in charges. It can have academic coordinators. It can have transport in charges. It can have housekeeping supervisors. So we should ensure that there is an effective ERT team members team which is formed by the school before we considering the school reopening. And we should ensure that the ERT member details are communicated to all the stakeholders in the school, including the students, housekeepers, or transport providers, or security people, or the staff and the students. So everybody should be aware of like who are our ERT members, what are their contact details. So we can use the notice boards communication mechanism to delegate this information, or we can use even circulars or notice boards, social media platforms, anything to ensure that the details of the CRT members are circulated and aware for everyone in the campus. And we have to ensure we have to develop a new set of operational process and policies. This can be ranging for various aspects, including security, area control, cleaning and disinfection, mask usage, temperature monitoring, infirmary practices, washroom usages, admission process, parent visiting the school. So a lot of operational process and policies around various things like this has to be even developed, like even including garbage disposal, managing your courier and parcel in the school, visitor visiting the schools. So all these operational aspects has to be looked into a new practice, and we have to have policies around all of these activities. We also, ERT team members need to ensure that there is an incident escalation matrix that is developed. Incident means like anybody developing a symptoms in the home, or anybody developing a symptoms in the school, or somebody developing a symptoms while coming to the school, or somebody a visitor who come to the school and start developing a symptom in the school. Like a lot of incidents you may come to face during the situation, which we have to ensure that there is a plan for managing such incidents, and there is an escalation system where everybody who come across such incidents escalate this incident to the ERT team members, that is the emergency response team in the school. As I told you, we have to identify various contingencies ranging from somebody developing symptoms in school, on the way to the school, a visitor, or somebody in infirmary getting serious complications, or even somebody who is absent in the school for a few days, or even somebody's family having COVID-19. So all those cases we may need to have a close look into and develop as like various contingencies plans around those incidents. We also have to develop response plans on these various emergencies. For example, such contingencies arise. What is our plan? Like, for example, a student developing symptoms or a staff developing symptoms in the school. What is the immediate step that you're going to do? Like shifting them to a separate room, making somebody to pick them from the school, uh, uh, providing communicating to these to the others, following a testing protocol, quarantine norms for the high risk contacts. So all those things has to be followed, and it has to be developed in a form of contingency plans for all these various emergencies that you may you have to, the ERTT members have to foresee this incident and be ready with this contingency plan, so that anytime such incident happens, we are ready with the action plan for those type of emergencies. And it is also important that ERTT members review the mechanism, like entire action plan which they have made around COVID-19 process in the school. Their new protocols, policies, and other areas of concern are reviewed on a regular manner. It can be a daily basis or an alternative day basis. They can set up a communication platform within the ERTT members where the proper communications are timely done and the things are governed by the ERTT. So review mechanism also can be done by using having an area-wise checklist, or like having a proper check process by the ERT members on a doing a regular inspection on area across the school. So these all can be something which they can be doing as an actionable. It is also very important that the ERT team need to ensure that they have planned to buy and stock the COVID-19 essential items, which include the chemical supplies, the PPE kits, temperature monitoring device, and various other things, which I will give you a slight glimpse in the last slide. So these are the key actions that ERTT members are responsible. Also, they have to be, while selecting, it is very important that we select the people who are really active and interested. It should not be something which is like forcefully done for the sake of having a team. So the activeness plus the interest level has to be checked before we formulating a ERT team. Coming to the second thing, it is training and awareness and communication program. This becomes a key activity of the ERTT member again. They have to ensure they form a proper training plan for the department wise, and they also have to develop a training materials for various stakeholders. For it will not be the same training material that is used for the teachers and the students. It will not be the same material used for the housekeepers and the transport, so or security. We have to ensure the department wise training materials, the key things that they need to follow, the key hygiene requirement that they need to follow, the social distancing, and the other check process that they have to do. For example, if it is a housekeeper, we have to ensure incorporation of cleaning frequency, dilution of the chemicals, what all the PPs they need to use, what all they need to maintain after the cleaning. So like that, we have to ensure department-wise training materials are also made. For example, if it is for teachers, what a teacher is supposed to do in the class, what are the things that they need to ensure being monitored and followed upon. Similarly, for students, what are the things that they can do or don't in the classroom, washroom, or various areas of presence. So that's the key important action by ERT team, that developing a training plan and having a training materials, which is department wise. So if you refer, we have a lot of materials. This is already available. The pointers are already available in all these SOPs. We only have to do is like we have to segregate it and ensure that it is being streamlined as per the requirement of each of this department. It's very important that ERT members to ensure that everybody in the school, including a grade 1 student or a pre-primary student to a housekeeper in this school, are getting trained under this training plan on COVID-19 precautions and protocols in the school. We also have to see that developing some new signages and communication mechanism. For example, we can have written signages, we can have posters being made, or we can have developed new set of signages, digital manner, or display in communication in notice boards or digi boards or school circulars, display in classrooms, washrooms, or buses. Wherever possible, we need to ensure that this sort of awareness is created by having, which makes like a constant reminder for people. So it can be area wise, specific, and based on what action that they have to follow in those particular areas. It is also important that a frequent review of training effectiveness is done by the stakeholders. For example, like teachers can be doing this for the classrooms, the activity rooms, the activity room in charges can be taken care of. Similarly, as transport in charge can be taken care of, like a review of effectiveness in the buses where they're finding any issues. It is important that they communicate this to the ERTT members so that they do a refresher training or like review the situation and do a new set of arrangements to address this concern. It is also very important that to display the local nearest COVID-19 hospital, state, and local helpline numbers in the notice boards and in the classroom if possible, if required. At least it should be made in common places and infirmaries, and ERTT members should be having it checked whether the numbers are functional and active. And this details has to be also made aware with everybody. There should be again, like ERT should be doing a review mechanism and communication whenever it is required. For example, whenever they are finding a lack of awareness, we can reiterate the requirement in the training manner, like circular or social media emailers or like public announcement PA systems, which can be used. The thing is like day to day, this process effectiveness in following the protocols has to be reviewed and validated. Another important thing with the parents and the student, we can use circulars as a form of communication on a periodic basis. We also need to ensure that consent forms are being obtained from the parents about student visiting the school. But also it's important to collect the health declaration form from everyone who is visiting the school. It includes the student, it includes the staff members, it includes the visitors who are coming to the school. The periodicity can be decided. For example, students can be done in 3 days one, staff can be done 3 days one, visitor has to be done every day manner. So this is the way we also have to ensure that we do have a idea on the health status of everybody in the school. It is also important that any new training needs comes, for example, area specific or department specific. If it comes, we have to ensure that these new training needs are fulfilled. Also, refresher trainings are incorporated in the training plan as whenever it is required, based on the gaps identified by the various stakeholders. So these are on training and communication part. Coming to the physical distancing and the school staggering plans, which is the most important step which I can say in this entire process, we need to ensure that as much as possible, we should have people kept in a distance of 2 meters away. For this, we can use demarcation and box lines, but just by having these lines or boxes will not ensure this. We also should have some vigilant monitoring of whether people are following these protocols. We can also have signboards in all the vulnerable locations like washrooms, at the entry points or activity rooms, or even in the corridors, for sake, like if you ask me. So this is to ensure again, we can have floor stickers, we can have boxes or lines made, or even like signages, which is acting as a constant reminders. And some people who are like, doing rounds to check. So everybody will become responsible. So that has to be the message that is passed to everyone in the school, so that people are cautious enough to ensure this. And the very important thing is like the discussion on this was on from beginning of lockdown. Like okay, like when the school reopens, what is the different staggering plans that we are going to incorporate, considering for the student to visit the school back. So the options, various options discussed then was like, one is like, splitting the school into 2 shifts in the morning and afternoon, and one was like having alternative day schooling for different batches, and the third option was like having classes with odd and even roll numbers. So each of this plan has got their own advantages as well as disadvantages, including transport cost, I can say. Another one is technology requirement, then number of staff which would be required more than what it is present to consider the new requirement. Also, in case like when we are doing continuous schooling, like we will also have issues with the furnitures and all, which will not suit for the requirement of the young student if they are attending classes in senior grades, or senior students attending classes in the lower grades. But whereas when the school is having space, we would still consider of like with less of this type of plans, we can utilize the maximum space or extra rooms and all which is possible. Like we would still consider ensuring like the strength of each class is not more than 50%, where social distancing can be possibly made. Whereas like this will be in this new normal situation, continuation of online classes will be definitely ongoing for quite amount of time from here on. We have to ensure that the school need to be provided with the tech-enabled systems, like enabling online classrooms, so that even one batches attend, the teacher can stream this online where the other set of students attend the class from their home. We should be considering avoiding any crowd gathering events, sports, and assemblies where social distancing is not possible. As I told you already, we have to have some vigilance members in the school who actually does this rapid rounds in between and see whether this is being strictly followed, especially during the recess times and breaks. This is very important, because they may not be listening to an AYA or a supervisor or a peon. So we have to ensure somebody who is like, stronger in demanding the requirement is like being made in this duty. It's also important that the controls are made during arrival, dispersal, recess time, washroom, and lunch breaks. For example, what we can do is maybe we can actually have the staff members taking in charge to ensure these controls are made, especially during arrival, dispersal time, or even during the recess or break times. Also, like we can also see the requirement consideration for new security or the new staff requirement, just to monitor these important aspects of arrival, dispersal, and break timings. So that's very important as well, to ensure the distancing norms are followed. School transport also, like when we consider if the school transport, if we are planning to provide the school transport, we need to ensure during this phase of time we have to like ensure the physical distancing in these transport buses as well, like where seating arrangements are done in such a way, same like classroom, where alternative seats have been allocated for the students to use. We also need to ensure that in many of the cases, like private or public transport, the social physical distancing norms are not possible. To an extent, what we can see is like we can send out circulars stating the parents to avoid sending the people in who are getting transported to the school in such manner, or else they can use a hired autos or any other systems if feasible. If not, if you're finding this is a big challenge, like we should be considering continuation of providing online classes for these students wherever they are not in a position to come to the school in a environment where physical distance, especially where including a public transport. And we should strictly ensure there is no contact sports in the school, which is going to happen in this time. Coming to the visitor and material movement control mechanism, we have to ensure that all unnecessary visitors are avoided. This can be checked, this can be strictly enforced to the security in charges by the administrators. Wherever feasible, we have to ensure that meetings or such visit can be done over the video conferencing or telecalls. Unless necessary, we should not be promoting any visitors, including the parents, which is if it is unnecessary. There should be strict visitor screening, including their health declaration, Arogya Setu app, the temperature screening, and the other symptoms of the illness, and usage of mask and the other things. So it is also important that at the entry points itself, like they start following the physical distancing protocols, we have to ensure those areas are being demarcated and clearly distinguished. All the people who are coming into the school, even if it is student or a visitor or a staff, like it is very important that this health is monitored, the temperatures are monitored, and these are being recorded by the security in charges. We can have infrared thermometer, or we can also have sensors which can be used for measuring these measuring these temperatures. So it's also very important that security staff are made aware of all these practices, what they are need to be following strictly in this area, and there should be a regular briefing at the morning, as well as like a debriefing session at the end of the day, or when the shift is getting handed over to a new security personnel. So that is a responsibility that administrators should ensure that this becomes a routine program in the school. We also can see some records being maintained for all this to verify. We have a system generally to provide visitor ID cards. What would ideally recommend is like to avoid those practice till the time this pandemic ends. What we can do is like we can do e-slips or like paper receipts, like visitor slips can be used for whoever is visiting to the school during this time, just to avoid the contacts and the contact of the virus in these ID cards. That's the reason we are trying to avoid this. Also, we should have a plan for managing the parcel and courier movement inside the school. So it is advised that we can have a dedicated system or boxes to collect all this courier and parcel whichever comes to the school. We can also have a check drop boxes, everything at the security gate itself, which is in a secured manner, where whenever the person comes to deliver it, it can be depositing it over there. It can be the security in charge can be taking all the note of the details, and they can be contacting the administrators to update it, and administrators can create a mechanism where a dedicated person only comes and collect these couriers and parcel, and we can try to dispose as much as outer covers and all those things in a safe manner there and there, where we in a proper secure dustbins, and we only carry the details of the courier inside after sanitizing the hand. So this again, there should be a key focus on training requirement on how we will manage on parcel and courier which arrives to the school. Again, food service delivery partners like Zomato, Swiggy, if people are ordering food and all from outside, it is important that they also are not allowed to enter to the school. Like they can be dropping it in the security desk where people can be going to there and collecting their deliveries. I would be the best advice to avoid as much deliveries to the school, wherein which we can actually promote the usage of home food and carrying their own cutleries and crockeries and the water bottles. The security also should be clearly instructed about the incident management at the entry point. Like for example, somebody develops symptoms in the gate itself, or somebody showing some temperature which is not acceptable. So this type of incident which comes, so some visitor who comes to the school and is not obliging to the requirement of checking a temperature, or he's having some symptoms, he's not wearing a mask and entering. So there should be a proper communication to the ERT and the administration team from the security desk, and there should be a communication device which is provided to them, and that type of contingency also has to be mapped upon in your emergency response plan within the school during this time. So communication becomes a very important aspect during this. And also it is important that we should have a stock of PPE kits and some essential items even at the security point. For example, somebody comes to the school without a proper mask, or or some damaged mask, or non-acceptable or like dirty mask or anything, like, or even they need a gloves extra, or those type of requirements can be provided in the security main desk, including the sanitizers and the other requirements. So these all things becomes the responsibility of the RT team, where in which they check, okay, whether we have all these arrangements at these entry points. If you have two gates, we should try to scatter these entries, and we should have the control measures established in both the gates, or even if 3 gates, the same measures follows. So we should try to use the maximum options during the arrival and dispersal time. Very important. Hand hygiene, very important steps that is advised even by WHO to control this disease. We should ensure that there is an availability of dedicated hand wash stations, if possible in entrance, or if not, in all the washrooms and the other vulnerable locations. And similarly for hand sanitizers, we should ensure that this is available in all the locations that are vulnerable, including the entry points, corridors, office entries, staff room entries, activity room entries, lab entries, and all those areas. We need to ensure that a requirement and provision is made for availability of a hand sanitizer. We should try to ensure as much possible to have a contactless option, which wall mounted is the best one, with the sensor. If not feasible, at least the pedal operated ones, to avoid that the rapid contact, frequent contact with the dispenser is avoided. So it is also important that we communicate with the students, teachers, and the other staff members that they carry their own sanitizer bottles, at least a small sanitizer bottles, which can be used during any emergency situations that they may come up with during the travel time, or any other situation where they don't find a sanitizer around they can be using. So we can always instruct the students and the staff members to carry a set of essential PPE kits, including sanitizers, mask, and gloves if required, and face shield and all if required. Training on hand hygiene also has to be a very important steps that we need to incorporate in all of these stakeholders training. We need to ensure that communication on hand hygiene is done properly, how to wash, when to wash, what to use while, and how to properly do an effective sanitization. All those things has to be detailedly covered in these type of trainings. And we also have to ensure that there is a frequent reminders of hand hygiene. It can be done by having a lot of signages. It can be done also by using PA announcements, or we can also do it like bell system. There are some people who does this mechanism called as bell system, which acts as like a frequent reminder for hand hygiene. These are something which the school can decide upon. Signages, all the vulnerable areas should have signage. For example, if you're planning to keep sanitizers in one point, we also need to put a signages, just a small signage or something nearby, which speaks about how to do an effective sanitization. When we maintain a hand wash station, we also need to put a signages nearby saying how to properly do a effective hand washing steps. So that all becomes important in terms of hand hygiene control. Coming to the another important steps in this control mechanism is like usage of mask and PPEs. PPEs include the gloves, the face shield, and the mask. These are the three things generally which can be used. Now the very important thing in this is like we have to ensure this is communicated clearly and it is mandated to everybody who visit the school, including staff or student or support staff or a visitor. Without a mask, we should never be allowing people to come inside. And also, it's very important that are they wearing a correct mask? There are we have to ensure a proper communication, or signages are also displayed on usage of correct mask and what types of masks that are acceptable in the school. For example, what we see is like this wall mask with the valves. Like this is generally an anti-pollution mask. This is not the right type of mask for preventing COVID spread. What happens if the person who is wearing such mask can always spread, because the air only get filtered towards him, but it doesn't filter the air which is coming from inside. So what happens is like the virus can escape through this air. So it is always important that we should not promote a valvular mask usage. We should you can use a layered fabric mask or a medical mask which is available in the market now easily. If it is a fabric mask, it has to be a layered mask which is used. So it's very important that we communicate or incorporate these details also in the training when we are actually doing the training for various stakeholders in the school, including the students, how they come and how they have to wear the mask, covering nose and face, not keeping below the chin, not hanging on the ears. All those things has to be even covered in those trainings. It also is very important to demonstrate the importance of hand hygiene before using the mask and after removing the mask. Also, we need to ensure the training on correct usage, as I told, how to wear, how to change, discard, like even changing, like while removing, how to safely remove that, how can be washing that mask, and whether mask can be shared or not shared, how we can dispose this mask. All this has to be incorporated in the training programs. So school also have to see separate bins for disposing the mask, which can be demarcated like mask disposal bins or respiratory hygiene disposal bin. It can be colored. It also can be labeled with bio waste bins. Like it is generally yellow in color, or if not available, we can use a sticker or something which is remarked. And people should be made aware. Okay, if you want to change your mask, or if you feel your mask is dirty and you want to change, please ensure these masks are disposed only in these dedicated bins which is kept in these places. There should be a stock of masks and PPEs available in the school infirmary or with the administration ERT team in case of usage in emergency. For example, somebody want to change their mask if it was not carried a spare mask, so we always can be providing. But we should be insisting people to carry their own essential PPE kits and things. But we have to always consider having a backup of things in the school. So that becomes a stock check process. Has to be something which ERTT members has to check during the every week manner or on a fortnightly basis. We also need to ensure that signages are displayed in all the relevant areas on respiratory hygiene, cough kits, and mask usages. All the signages are available from WHO and Ministry of Family Welfare and Health. The signages are also available. You can actually download from there, or you can actually develop the school-specific signages, which is required. Very important step is like a cleaning and sanitization of the contacted surfaces of school or the areas of the school, including outdoor and indoor spaces. So how we can do this is like we have to ensure the availability of cleaning chemicals for the indoor and outdoor spaces. We also have contact what we say, like surface disinfectant chemicals, which include sodium hypochlorite, which can be used for the floor and outdoor spaces and washroom floors. Whereas like metal surfaces or wooden surfaces, we cannot be using sodium hypochlorite solution. We can use chlorosilanol, benzalkonium chloride, or an alcohol-based sanitizer. So this chlorosilanol you can find in Dettol as one of the ingredients, whereas benzalkonium chloride is there in Lysol, which is we use in home. So these type of chemicals need to be made available in the school, which can be used for the high contacted surfaces. Whereas for floor, we can use 1% of sodium hypochlorite, which can be made using bleaching powder, which is made like 1 gram of sodium hypochlorite in 7 liters of water gives you 1% of sodium hypochlorite, which is effective for virus on general surfaces like floor, commodes, and all the other places which they can use. And a clear instruction on this is available in Ministry of Health and Family Welfare website. I've provided you a link over there. We also need to ensure that the cleaning frequency has been clearly made, and it is made aware to the housekeeping staff. Dilution rates are explained, how to dilute, how to check whether it is correct dilution. All this we may need to provide some measuring jar or tools so that they follow the correct dilution rates. And the efficiency of the cleaning has to be checked by the administrator or somebody from the RTT members. And we also need to ensure that there is a maintenance of a cleaning checklist and records which we can actually monitor the frequency of cleaning and effectiveness. It's also important to train the housekeeping staff on correct usage of chemical, which chemical to be used in which places, what should be the dilution, what are the PPEs to be used while handling such chemicals. All those things has to be considered. Wherein which we also have to see the cleaning of frequently contacted surfaces, which include desktops, like the laboratories, activity rooms, then the libraries, then also like office setups and staff rooms. So these all places, including the classroom and tap, door knobs, all those places we need to see frequent contact, frequently disinfecting through the housekeeping staff in the school. So we have to ensure that they are properly trained. There is a time set for each hour or like a 2-hourly basis or hourly basis. People are trained to clean, and also like teachers also can call upon if there is an additional requirement of cleaning of their classrooms whenever they have to have a reassurance to ensure that it's properly disinfected. Also, usage of PP is very important. We should not be taking risk of causing a chemical hazard by inhalation of or consumption of chemicals accidentally. So we have to ensure they are using a proper PPEs like mask, rubber gloves, and shoes while handling all of these chemicals. It's also very important that all these leftover chemicals are disposed safely, not causing any damage to the environment. Also, we need to ensure that collection of this waste are made. For example, bio waste cannot be mixed, or infirmary waste cannot be mixed along with the other waste. It has to be separately sealed or put in a separate garbage bin, or it can be even labeled and disposed separately along with the waste. And the dustbin demarcation has to be clearly done in all the areas of the school. You have to keep these separate bins, especially in infirmary and some corridors and all. If you need with the label bio waste bin, they can dispose these consumables which they have used, like tissue papers or gloves or a mask or something which they wanted to dispose. This has to be disposed only in those such dustbins. Coming to incident management, very important step in the scenario. Like there should be a clear clarity on what to report, when to report, how to report, and whom to report. This should be made clear to everybody in the school, including student, support staff, and security and transport providers. So incidents, as we discussed, there are various incidents which we have already discussed. The category includes somebody developing symptoms within the school, somebody developing on the way, somebody who is absent for a few days from the school. Either it can be students or it can be the staff members, or somebody at their home contracted this disease and they are primary contact. So all this becomes the various incident which has to be like reported. The review of such things has to be happening, Communication transparency has to be made. There should be checked by the class teachers with the students on those details. There should be health declaration forms which will be capturing those details. There should be, discussion forums which will be used also to, like check such details. So all those, even the visitor who comes with symptoms, all this becomes like a various incident that we need to identify. And the escalation matrix, as it is already said, like when somebody come across such incident, we should have a clear escalation matrix, like whom I have to report this incident next. So that clarity has to be provided in the escalation matrix. So ERTT members have to develop that escalation matrix, and this is incorporated in their training plan with everybody when the training is happening. We also need to have set up a separate isolation room. This isolation room is basically to keep these people who develop the symptoms for a certain period of time, till the time their parents or the relatives comes and picks them from the school. So this should not be used by somebody else. There should not be other person visiting. They can be provided with limited furniture and water if required, and PPE kits. So this type of setup rooms can be made by this ERT team. If not available, if you don't have a lack of space or something is there, we have to make sure a separate arrangement within the infirmary has to be made to like transfer it as an isolation room. But in that case, we have to ensure that normal infirmary will not be kept away from the isolation room. The contact or distancing norms are all made, and PPEs are all used properly. It's also very important that before the school reopening, we have to, there are times like, somebody got ill and we wanted to contact the parent, and parent number is like switched off or not, number is not existing. So we have to ensure that every parent's contact numbers are updated before the school reopening. We have to check with the students, or when we are sending the circulars, it has to be made clear that they give an updated contacted numbers which is reachable to them. Maybe alternative numbers also can be used. So these teachers, including teachers, should be having the details of the students in the classroom along with the admission or administration team. We also should have updated details and functional numbers of local health authorities, hospitals nearby, and state helpline which are functional. It is not just like you're displaying the numbers. We need to doubly sure that these numbers which are available are functional and active. So we have to do a random check in between and see, okay, this is functional. And a very important thing, as I already told, an incident manager is trained a team and an emergency response team. And various actions that they have to initiate where they have to manage the contact or the space or like the people who are in contact with the suspected individual. So those actions are all has to be clearly made available in your contingency plan or the record of the document which you are preparing for the action message that you are going to initiate for various contingencies or incidents that can come across in the school. And it is very important that communication becomes a very important aspects of it. Any time whenever an incident happens and a suspected thing comes, it is very important that it is transparent and the communication is made with multiple stakeholders and people, so that everybody is aware about such scenarios in the schools. Okay, like we have come across such situation in the school, we have developed so and so action, and we are doing so and so action. So let it be clear with the people, even including at times if it is a case of serious doubtful scenario, we can also inform the parents as well in these cases, so that there is no panicity or panicking aspects of fear developing amongst the people. So transparency makes things like more even easier for ERT team to function properly. Very important step in this is like monitoring the absence and travel history of the people. Like for example, somebody not coming to the class for 2-3 days or more than that. It's important that the teacher checks such absence in the classrooms on a regular manner, and it is being informed to the ERTT members or the infirmary in charge. What ERTT members can decide is like they can contact the parents and they can actually like check for the reason of absence. If the reason of absence is more than, if it is personal or even like, or if any other illness, it is important that to collect a health report if the return of leave is after 4 days. So minimum 3 days or more than that, we have to ensure that we collect a medical report also. It's also important that in the health declaration form, we consider incorporating the travel history. It also is important that teachers check with the students whether the family members, whoever is having a travel history, or whether they themselves have a travel history. Those type of details are also collected and it is being informed to the ERTT members so that we are better prepared to handle such situations also. So if we have travel history or if we have some absence, if we can even advise them to continue, stay home and like attend the classes online. All those things can be, consideration can be given by the school to avoid the higher risk that can be caused. Coming to the like space or contact management in case of an occurrence. What very important step that ERTT members which would be happy to initiate in case of an occurrence of such cases. It's like, okay, the first thing is like, they need to shift the suspect to the isolation room, as I told, where we can have an isolation room, we can have a simple setup arrangements, and they are shifted to this isolation room, wearing PPEs and gloves and all. They can be made to sit over there till the parents comes and pick them up. If it is a staff, if they are having their own vehicles, they can be allowed to move, or else like they can be, somebody can be organized from their family to come and pick up them. So this type of arrangement has to be done. Also, it's very important that ERT immediately, like plan for a disinfection of those areas which are contacted by the suspect. Even if it is a flu-like symptoms, we should not be taking a risk of, okay, it's a normal flu. It's best advised for the safety of the other individuals in the school. We always have to take this disinfection protocols as per the plan immediately after the suspect is shifted to their home or environment. So we also have to ensure that next step in this is like we need to ensure that suspected case, the suspected individuals undergo a testing, COVID testing, and the report will be, we can be asked by the school ERT team. If the test report is negative, we can be welcoming them back. Whereas if the test report is positive, we have to further act upon risk profiling. Risk profiling is to identify high risk individuals and low risk individuals. High risk individuals will be like somebody who has been, was the primary contact of these suspected individuals who are tested positive. Whereas secondary contacts are the people who are actually not in direct contact, where they will be contact with the primary contacts, or some areas where they are being in contact with. So we have to ensure that risk profiling is also done by the RTT members to ensure and identify the mapping of primary and secondary contacts. So we can actually like do the quarantine norms for these primary and secondary contacts if required based on the test results, or even if you like till the test reports comes, we can also follow these quarantine norms. And if the test report comes positive for the suspect, we also can initiate the testing for primary and secondary contacts, as well as concerned suspected people in this cluster, to ensure that all of them are safe. And if required, if you identify there is spread, the school event can be closed for a certain amount of time, where the situation is further analyzed. But the continuation of online schooling can be continued at these points of time. It is very important that there is a clear communication setup which is done in any which case when a suspected case comes or a positive case emerges in the school. There should be transparency in communication with all the stakeholders, including the parents, especially in case of this type of incident. Another very important area which we may need to have to look into is like the mental health and well-being of students and the staff. We have to ensure that school have a supporting framework for assisting their requirement on these aspects or the areas where the students can be made available to reach out to the counselors or academic coordinators or somebody whom they wanted to speak. School can actually create a space or communication platform where they give mail IDs or contact numbers wherever they wanted to have they have stress or anxieties or fear around this when they are in school or when they are at home. So these type of counseling services has to be offered by the school, which it's one of the key steps that we should be planning to incorporate in this. These details are all available in the Manodharpan website by Ministry of Human Resources, where we have lot of like key guidelines on how various situations, what we have to do. All this can be clearly referred from this website. Also, we have WHO website, the World Health Organization website also have got a vast amount of areas that covered in the mental health of the student and the people during the COVID lockdown and the times of COVID. So this is generally untouched area, but we have to be ensuring that these services are quite active when we are considering the school reopening phase. These are some materials and all which I would recommend the school to have it in their kit. One is thermometer for checking the temperature. We can have IR thermometer. We can have sensor based. We can have face shield for the office staff and teachers if required, and we can have a face mask. Some if you wanted to have food sanitization option, we can also have food dip and tray and mat, which is not very important, but still we can consider based on the risk level, or especially for the lower students. If we are operating with the pre-primary students and all those type of classrooms, we can always have extra precautions of having food dip and all those things. Disposable hand gloves, hand sanitizers, food operated sanitizer stand or sensor based dispensers. Pulse oximeter has to be there in the school, which is mandatory to check the oxygen level, because generally people will not just show the temperature as symptoms. So oxygen level is something which always we can be using to find it out. Also the other factors like sense of taste or smell. We also have to have bleaching powder, stock of sodium hypochlorite solution, or any of those which can be used to form hypochlorite solution of 1%. We need to have stock of chemicals which contains benzalkonium chlorate, which is generally in Lysol or Dettol. We can see that material also available in the school. We can have Domex and Harpic, which also have got sodium hypochlorite in it, which can be used for the toilet commodes. Paper cups for drinking water. Generally, we should try to stop using the glass which is shared, so that the risk of transfer rates are high. So we should see something like paper cups which can be used. A dustbin, as I told, has to be demarcated for mask or other respiratory hygiene consumables which they are used to. We also have to see some availability of tissue papers if required for sanitization, microfiber cloths for cleaning the surfaces like doorknobs, then handrails, staircase rails, all those things. School can also have a spraying machine and PPE kits. It won't be viable to have always calling, for example, some case emergency. It is not viable to call somebody from outside and pay every time to do this thorough disinfection. So what school can do is, like, we can buy a spraying machine, we can train somebody from the housekeeping department or administration, use the PPE kits and use the right amount of diluted solution, and use this for spraying those suspected areas in the outdoor environment especially, whereas inside indoor environment like benches and all, we will be using the contact surface chemicals like hypochlorite or benzalkonium chlorate solutions or alcohol-based solutions. So these are the things which I wanted to cover. Like my key references are made from World Health Organization website. These are the links which you can see. CDCs and the Ministry of Health and Family Welfare, and various SOPs which has come so far regarding the school reopening protocols and the SOPs. These are my references. Thanks to team CEIR Global and my Edunation family for assisting and supporting to make sure this session is delivered to all of you.
I think we can go for the.
Thank you. Actually, there are certain chat box, sir, can you just, rewind your slides for a second, because many people want to see the slides once again. You can just scroll down. It's not a big deal.
Which slide in specific, sir?
They said previous slide, all that. You can just, 1 second, you can show one slide, then anyway, it will be available in our Facebook also. You can revisit later.
Yeah, sure.
And there are certain questions also. Radhakrishnan sir, you can just read out the questions for sir. Radhakrishnan sir, the chat box, if you see, there are some 2-3 questions.
Yeah. Is this mandatory for Uday? There is one question. Is this mandatory for children to wear N95 mask or cloth mask is okay?
Cloth mask is absolutely fine for students. N95 mask is not advised even by WHO, or it is only for the hospital setup. We can have a multi-layered cloth mask which is available in the market. It should not be a single layered mask. We can have cloth masks which are like layered one. So we don't need to have any N95 mask or something which we can also cause other dangerous situations. And they will not be even comfortable in wearing such mask for a long time.
Very true.
Yeah.
Cloth mask is fine. Only ensuring that other protocols are followed. Wearing the mask properly.
Yeah. Thank you, Uday. Any more questions from the audience?
No, there is one more question. When we encourage drinking glasses, can we not ask no sharing of their own water bottles instead?
Yeah, that is also like something which has to be ensured. People should be communicated to bring their own cutleries and crockeries, including staff and students, including water bottles. They have to. We can provide water from the school. The water should be tested for all the drinking water essential parameters as per IS 10,500 standards, and this water can be fetched by the students using water bottles which they are carrying. But we should not be providing any common glass or shareable glass. If not, at least we should be having something like a disposable paper cups, which is again like again the possibility of transmission is also there. So highly advised is like to carry their own water bottles and cutleries and crockery.
Yeah, Uday, do you have any special suggestion on lab in the laboratories?
Laboratories instead of what, sir? Like computer labs or other physics science labs?
In computer lab and also in science labs, because touching happens there, no?
Yeah, science lab. Computer lab. Firstly, it is very important. Before every batch enters the classrooms, the laboratories, we should ensure the keyboards and the surfaces of the screens are all cleaned and sanitized using any of the chemicals which I have prescribed already. That is very important. Similarly, for the activity rooms and the labs, like tab, the surfaces like the tabletop or the apparatus which they are using. All those things have to be sanitized. We can use a sprayer in this Dettol filled in, Dettol diluted in spray bottles, and then can use tissue papers or this thing, microfiber cloth, and sanitize those surfaces as well.
Yeah. One more question. There any advice on ventilation in classroom?
That is the best advice even WHO is giving. Like we should ensure as much ventilation possible. We should keep it open, and even like doors, windows, or even if you have curtains and only let it be wide open, and let as much air flows inside, and if the schools are something like with an AC enabled system, still we consider to keep the door and windows wide open.
So what is your advice on AC? AC should not be operated.
AC, there is not, somebody is not saying like we should not operate AC, but AC can be operated in a temperature which is set to 220 to 24, not cooler than that. But I would advise, based on my experience and readings, I would say like we should not be using AC for quite some time.
They should not use. That is better.
Yeah, that
So,
would be my
so
advice, my personal advice. But for the office and the other setup, when the SOPs came, they have advised to use AC in an indoor space where AC can be limited to the range of 20 to 24, not lesser than that.
Okay, there is one more, some suggestions and questions. Any advice on ventilation in classrooms also? I read somewhere too much of talking will spread the virus. Because teachers will be talking in the class, maybe on that. Too much of talking will spread the virus. If someone is symptomatic, then how do teachers take care of this?
Teachers will be
Good question.
definitely advised to wear a PPE, like mask they will be wearing. Also, we can, if you like, we also advise, like in our set of school, we will be definitely advising to have a face shield as well for the teachers, because they may have to speak a little loudly to ensure that their classes.
Yeah.
So face shield becomes a good option, which is cheap and available. This
Yeah.
can be provided to those cases.
So mask that covers the whole face, that will be advisable for teachers.
the shield kind of thing.
Shield type.
Shield type of, mask. Mask, a normal cloth mask is fine. So
Yeah.
I'm saying is like,
But sir, I've seen people wearing both mask and shield.
They should also be feeling comfortable, and anyways, only big thing is like ensuring the distance and ventilation. If that is there, only one option also will work out. But it is best to have both. Like,
okay.
Also, we should see the convenience of the people who are like, when they are wearing both, how convenient, comfortable they are to deliver a class. That also we have to see.
Yeah. And also Arup Sinha has written that, hi, during arrival of students and staff in the entry of the school gate, what is the easy way to sanitize 500 plus people within given timings of the school? Because we need to maintain the school timings.
Easy sanitizing option is like, we have to, as I told you, we have to ensure people, see, we will be definitely providing sanitizers at the entrance of the school, but it is not possible that everybody like dispense it and like it take time. So it is one thing can be done is like, anyways, like people will move in a line wise manner, so that arrangement can be seen, or otherwise anyway people, we are instructing them to carry their own sanitizers, so they can actually do with that at the entry points as well. Like, that is a two viable option. Otherwise we should have a dispensing unit which at multiple location on the way also, like where people can be doing it.
Yeah, then another point, how will they take care of checking of work and examinations? That means the notebook exchange papers.
Yeah, very good question here. Like, it would be advised between the students, there would not be exchange of any personal belongings like pen, papers, or books or other things. Whereas when the teachers are checking, we will be recommending them to use gloves for notebook checking practices, so that the risk is less there. And the teacher, after the checking process, she can discard the gloves to the bio waste bin, which is left over.
Yeah, and Uday, one more question. Do you have any special guidance on library management? Because library is a place where exchange takes place, a lot of exchange takes place, no?
My best advice to library would be like, we have to keep library shut. Maybe we can see a digital learning or like Kindle type of thing, which we can be followed for certain period of time, because that's going to be a high risk zone, and like contact with the saliva and all those things can be also happening. So I feel that is a very high risk area, which we may, similarly like the art and craft activity room also, I feel like a slight amount of higher in risk.
Okay.
We may need to see those type of activities can be controlled or minimized.
That means lending books can be controlled during this.
Yeah. We can have a digital option. Now we are sharing a lot of things on contents
Yeah.
online. Similarly, we can share those things as well to the people.
Yeah, that means we have to advise for digital library,
Right,
use of digital library. Yeah,
right.
yeah. But then
Right, right.
are the tent-like sprays in the entrances advisable?
Which is that, sir?
Tent-like sprays.
No, it is not advised. It is actually like this is like during this time, people like tunnel like of spray which is dispensing, right? This is what you are asking, I believe.
Yeah,
Yeah, so this is really posing a chemical risk, which is even advised by WHO not to use. These are typical Indian mindset they have developed in terms of promoting their business, and they wanted to do a lot of
yeah,
saving things. Actually, when the tunnel people goes to the chemical which is containing chloride and all those things will
Yeah, it
definitely
is
cause harm.
not advisable.
Regular inhalation can also cause a sort of mutation in the genes.
Very true.
right,
Should not be
right.
advised. These all are highly.
Yeah. And concerning the transport, now bus transport, do you have any special suggestions as a closing remark on transport once the school start operating?
Bus transport, I would really love. I think this is the toughest year for this transport providers. One, second, I don't think like this year it is going to anyhow work out in transport. Like I don't know if what the transport is going to happen. What best advice would be like one, ensuring the social distancing protocols in the bus, like where the seating arrangements are demarcated. Second,
Yeah.
signages displayed in the bus. Third, IR checking the temperature. There should be a temperature probe, the IR thermometer, along with all the buses, where IR before the boarding only like check the temperature of the student, so that no like a bigger amount of crowd. Like if there are cases of suspected cases, or you wanted to check the temperature of everybody. So when at the arrival time, it may delay the entire process. So the bus transport users, we can be doing at the boarding point itself by the IR, by training the IR, like they can check the using the infrared thermometer, and they can monitor. So that would be one advice which is used. And also like there should be sanitization of these buses, like disinfection using not sodium hypochlorite, either benzyclonium chloride or chlorosilenol, which is contained in Lysol or Dettol. Diluted form can be used
Yeah.
and sprayed and wiped in all these seats and contact surface by the IS after every arrival, so that before the dispersal again it is cleaned and sanitized. So that
Yeah.
type of measure.
Uday, another concern related to playfield and games and all. Do you have any special suggestion?
Contact sports are strictly no, but we can do sports like cricket can be done. Sports like, but we have to ensure that like we are not doing what we say saliva this thing. Although like in bat and
Yeah.
those type of thing, badminton can be allowed. Even we can like social distancing wherever it is possible. Those type of thing is slightly like can be considered. Whereas games like volleyball or games like football to an extent, I don't think, like it also depends upon the age of the people and the understanding level as well. Like,
Yeah.
no contact sports ideally,
Yeah, that's better. Yeah.
but racing, running, long jump, high jump, all those type of things can be considered.
That can be. Some athletics
Yeah,
will,
athletics can be considered.
Sometimes the shuttle badminton also, I think it has very less contacts.
Very less contact.
If they have their own individual rackets,
Yeah, correct.
if children are bringing into individual rackets, even in the music rooms, instruments and all, no? If many people are using the same instrument,
Yeah,
just like in the computer lab, there should be also sanitization, right?
right.
Yeah.
So some people have actually asked for this, please all sites once more. Extremely sorry, please visit our Facebook page, CEIR Global Facebook page. Everything is available. Because again, showing all the things once again is not very practical. Please visit our Facebook page. You will get many other sessions also, very useful sessions also.
Yeah.
Radhakrishnan sir, I think the time has come. Mr. Uday, can you just stop sharing this so that I can share our...
Sir, one last thing I just want
please.
slide Ryan Edunation family is coming up with a partnership opportunities for people who are interested to collaborate for building their school as a number one in their city, like like to increase the capacity of admissions and like better academic results and offering best like health, safety, and child protection support. So and increasing the revenue. So we have come up with a program called as Manchise. This franchise is something where like we will support your school in terms of academics, operations, as well as health, safety, and child protection. We'll be providing you assistance to become the first top school in your city with revenue and like 360 degree support basically. So you can reach out in case somebody is interested in this program. We'll take through our PV team and consider this.
Yeah. Even this health and safety aspect, if anything is there, you can contact directly to that will be better, right?
Right.
Yeah. If any school wanted any special guidance on health and safety measures while reopening and all, any training for teachers regarding related to this, you can contact Mr. Uday. He can guide you.
Correct.
Yeah. Now I think we can close that. We can close that sharing and move to our slides. Yeah. Station, sir.
Yeah, 1 second, sir. It is there now. You can have a small announcement of this. I think it is not.
Yeah. As usual, every Sunday we are conducting free handwriting sessions. And one of our director, Dr. Srishan Gopinath, is heading this. And tomorrow is Sunday, so at 4:30, people can join for this session, a free handwriting session. There is no age bar. It is very useful for everyone. So I would like to request you people to join. You can join or you can share with your relatives, friends, or kids, whomsoever it is. It is very good. A free handwriting session. Yeah.
Now I invite Dr. K.K. Shahjahan to give the vote of thanks to our chief guest. Shahjahan sir, please.
Right. Anyhow, dear members, dear participants, Mr. Udayakumar, I'm very thankful, and I was observing from the beginning to the end. I noticed your session was very informative. You have explained everything from top to bottom, one required to know. However, that this kind of means information is useful, especially in this time. But when I heard that, I have got a feeling that how to commit or how to execute all these things, it's doubtful. It's afraid I'm afraid of that. However, the information which you gave is scientific and we will have to follow. However, that we will become used. That's another. However, I'm not taking much time of yours. All the participants and Mr. Dr. Srishan Gopinath, then all other members and Radhakrishnan sir and all other members and Mr. Udayakumar, we are thankful for your effort and you spend time to educate us in this particular field, especially that's the requirement of time. Thank you very much once again, and we are expecting this kind of it means programs in future as well. It means that if we attend hundreds of programs like that, only we will get the full picture. It doesn't mean that now we got full information. However, I'm not taking much time. We, on behalf of CEIR, and we express our sincere thanks and gratitude to spend this much time for us. Thank you all.
Welcome.
Thank you, Shahjahan sir. Thank you so much. Thank you, Shahjahan sir. And a very special thanks for you because you are here, especially because of my contact with you.
My pleasure.
That on behalf of the whole CEIR team, participants, and also on my personal